We started off very nicely. We've had some inspiring direction on building community. But, as I mentioned in our last session, we want really to be able to apply what we have learned, and we want to understand how to apply that in different contexts. So we deliberately designed our session, our panel discussion, to include a wide variety of speakers representing different types of industry, and pose a number of questions to them from ourselves, but also hopefully from the larger community of attendees here. So at this point, I'm going to turn it over to Cinziana Lucian, who is the head of healthcare initiatives for the Detroit Regional Chamber. She's the co-moderator of this session. Cinziana.
Thank you so much, Sagar, and the Workplace Mental Health team for putting on this wonderful conference that I've had the pleasure to be a part of for a few years now. As Sagar mentioned, my name is Cinziana Lucian. I'm the Director of Healthcare Initiatives for the Detroit Regional Chamber. And for those of you who aren't familiar with the Chamber, we are a member-based organization, and we support regional businesses in a variety of ways. We focus on economic development initiatives to help drive our region forward. So the area that I lead is healthcare, and we work with our healthcare leaders and regional businesses to support employee mental health and well-being. As you already know, mental health has been top of mind for all of us, and especially here at the Chamber, and working with our regional businesses to help them better support their employees through educational opportunities, resources, events like today's conference, convenings, partnerships, and so forth. And I know Danielle mentioned in the beginning a platform called Wellness Works that has a variety of workplace well-being resources for all of you. I encourage you to visit wellnessworksdetroit.com, whether you're looking for mental health and other well-being resources for yourself, your team members, your company, etc. And just to kind of wrap up my intro, mental health awareness has been a topic that has been near and dear to my heart in my professional and personal life. And I'm very excited to be here and help moderate today's discussion. I know we have a lot of great points for you and takeaways. So now I would like to turn it over to our panelists and ask them to introduce themselves, share with us their background and their interest in the mental health space. So Sean, I'll start with you.
Hi, thank you so much. I really appreciate the opportunity to be a panelist today with this conference. Last year was my first year attending, picked up a lot of great information and tips. I really appreciate the effort that's going on here. My name is Sean Egan. I'm the Deputy Director for Labor in Michigan's Department of Labor and Economic Opportunity. I primarily oversee MIOSHA, Workers' Comp, Wage and Hour, and the Bureau of Employment Relations, but have been leading our state initiative focused on workplace mental health for more than a year now, but over the past year, and developing new tools and resources and having a lot of great discussions.
Thank you, Sean. Moving over to Holly.
Good afternoon, everyone. Holly Miller. I'm the CEO of United Way of Midland County, and really excited to be a part of this conversation, kind of representing the voice of potentially the nonprofit and all or some of the smaller organizations. So thank you, and I'm proud to serve alongside of our fellow panelists today. I guess I'll start off by saying kind of the me, we, us level of my interest in mental health and well-being. I grew up in a family where my mother struggled with mental illness, right? And so for me, that was something that we didn't talk about. And I think that's been, for me, very personally empowering to say, look, we need to take the stigma away from this and be able to talk about this as families, as friends, as coworkers, and normalize talking about mental health. So that's kind of the me reason. I think that also made me much more empathetic as a leader, especially as a community leader serving fragile populations, as well as really helping the nonprofit community as a whole kind of weather very difficult chapters. So from a team perspective, I have an amazing team, and to say that they have been challenged in the past 3 years, I'm sure all of you feel the same way. But here in Midland, not only did we go through a pandemic, but we also had a 500-year flood. And so while everyone else was pulling back, we were pushing forward, and we were pushing forward in a crisis, not just a pandemic, but also lives impacted, devastated by the flood. And even FEMA said to us, we have no idea how to help you. You're on your own. You're rewriting recovery. We've never done this in a pandemic, right? So tell us how it works. And so I think that became when I'm very sensitive to the impact that had on my team and continues to have. Luckily, we had focused on well-being. It's woven into our values. It's woven into our yearly performance evaluation. And so I think that was a good incubation, in that, but also going through this with our nonprofit community as well, and recognizing that there's compassion fatigue. You're out serving a population of people that are very vulnerable and fragile, and then having to actually hold the weight for them. So I think I've tried to weave it into our network to ensure that there are resources to ensure we're taking care of ourselves and putting our own oxygen masks on before we go out and serve the community, which I've seen that time and time again, and that can be something people ignore in the nonprofit sector. Lead with your heart, but not take care of your own.
Thank you, Holly. I really loved your explanation and kind of painting the picture for us that, mental health challenges come from various scenarios, and sometimes, we're not prepared for them. And we really have to, figure out how to work through it as a team, as a community. So thank you for that. Darcy?
Yes, hello. Happy to be here. Always a great conference, and congratulations to the team. It keeps growing. So I am the Chief Innovation Officer at NAMI, the National Alliance on Mental Illness. And hopefully many of you know NAMI is the nation's largest grassroots mental health organization focused on improving lives of those impacted, both individuals and families, by mental health conditions. I spent 17 years at NAMI. In my last position, I was the Director of Public Policy. I left NAMI for 5 years to run the Center for Workplace Mental Health at the American Psychiatric Association Foundation, and then had the opportunity to come back in a leadership role to NAMI. And we are now really focusing on building out our stigma-free workplace initiative, largely because more and more companies are coming to NAMI really seeking assistance with training and stigma and addressing a number of different issues in the workplace. And I would say the data has been so stuck in terms of less than half of people that live with mental health conditions get connected with care. We know from the CDC and census that the numbers of people experiencing symptoms of anxiety and depression are on the rise. And I just looked at the data today that goes through August 7th, and it showed for 18 to 29-year-olds, it's almost at 50%. So 50% of young career people are experiencing symptoms of anxiety or depression. So we have a lot of work to do. I know employers have been tremendous at really stepping up because they see the costs in productivity, performance, retention, recruitment, and people have expectations around mental health being more visible in the workplace. So I'm excited to be here, and there's so much opportunity, and thank you for the chance to be a part of this.
Thank you, Darcy. And before I turn it over to Sagar, I just want to say, we have so many great perspectives in the room with us today, and I do encourage our audience to ask questions through the questions chat, and we will cover those a little bit later.
So I think I'm going to begin by just allowing the panelists to reflect a little bit on the presentation that preceded us, and that is, building community. And as you know, panelists, we selected you because you represent very different workforces and so on. So I'm going to give you a very simple question, and I'm going to start off with Holly this time. So in your organization, how do you build community?
That's a great question. I think for me, it's a very intentional journey, right? And in the nonprofit world, what gets measured gets done. And so we want to ensure that we are infusing that as a part of our culture. So for instance, our values have a statement around well-being, balance, and taking care of ourselves. And that has now been infused into our employee evaluation yearly, right? So that employees are having to set goals intentionally, at least one every year, that that is tending to their well-being and maintaining balance. So I think that is, for me, it's a very intentional journey. The other thing is to really look at listening, look at strengths-based, like we've done a lot of work around strengths-based networking and working together. Midland is kind of unique. We had the opportunity to form a well-being coalition at a community level through University of Penn, and had 30 of the top leaders go through a 6-month certification in positive psychology as a cohort, which and I say our mayor, she has superpowers in convincing people to do things above and beyond. But that really has created a groundswell of not only looking at it beyond just one single organization, but how do we create a culture in our community that fosters well-being, as well as resources to bring into organizations. So I know all of us, we now have over 200 people certified, and they go out and are like lone executives and make presentations at staff meetings into other workplaces. And it's, for me, a great way to give back, and also a great way to invite new people into my organization that can share their perspective. And we do that monthly with our team. We have lunch and learns around it. It's almost a drip effect.
Yeah. So Holly, I'm detecting several themes here. One is that in the Dr. Porath's presentation, the importance of leadership in trying to say this matters, and you've illustrated how your organization, by incorporating wellness even in the annual performance review, it is a real way of saying, yeah, this matters because it's actually part of your performance review. And you've identified several other strategies, including, I think one of the other key messages of Dr. Porath is that it's not only about negative things, like, we're so used to evaluating things, finding a problem, and then saying we've got a problem, and we've got disgruntled employees or something. But there was a heavy emphasis on positive interactions, building community to foster positivity, and then you've had a chance to really amplify that message. So Sean, you work for the government. That's okay. I'm a believer in big government, so you're okay with me. But it is true, and I think one or two of the questions that came up said, sometimes large organizations like government, they're somewhat resistant to change, and they have lots of established policies and things like that. So in a kind of staid and maybe a very dare I say bureaucratic environment, how can you foster community in your work?
Yeah, I think I appreciate that question too. And I was thinking about some of the questions that I saw during the previous keynote speech on, we're big, we have different shifts, we have all these types of things, and we certainly hit all those buckets. I think our department alone in Leo is about 2,700 people across all kinds of different work, all kinds of different places, some hybrid, some fully remote, some in person. So you bring some unique challenges, and many of those departments aren't connected across each other. So we've been very intentional about creating various ways to show meaning for the overall mission of the department with everybody's type of work that they do. We know that meaning is very important for all of us. It's really important for young workers to feel connected to the work that they're doing. So we work very diligently and very hard to make sure that leadership, including myself, are communicating throughout Leo on how your work connects to what we're trying to accomplish, which is important. We try to create a lot of connections. So again, on leadership and being intentional, I might not see all the folks that I work with all of the time, but we make sure it's very important to us, and they recognize the importance of the connections we want to see there. So tailgaters, the old wear your favorite team shirt before the big game, all those kinds of things to create connections. But we've also been expanding more and more employee resource groups, which connect different parts of our department together so that people with common interests can share. One of those is just simply a wellness group where all across the department you can learn different tools there, creating a lot of touch points. So people are going to find support in a whole myriad of ways, and we don't know where that's going to come from for them. It could be the regular email communication you do, it could be a video thing you do, it could be a training thing you do. So just making sure that you're creating a ton of different connection points or touch points for people to jump onto. We have engagement teams across the department that are multi-departmental groups that work on finding better ways to engage with people. And then certainly as a leader, making sure that you're available and accessible to folks. And I personally take great pride in responding to all of my coworkers and colleagues as much as I can when I see them, engaging with them and talking with them about whatever's going on. You'll learn that I'm a shoot the breeze kind of person. So I like to shoot the breeze quite a bit and just connect with people and making sure that that carries throughout all the leadership chains that we have across government. And Sagar, we're also doing things like making sure that we're building into our metrics how people are feeling. So we haven't done surveys in the state of Michigan as an employer just on how you're feeling, but we're finding ways to do that. Building in metrics around how much PTO are people using in a positive way. We want you to use more. Pushing down from me down is, if you should be looking at calendars, and if it's, you don't have to pay attention day by day, but if you see one of your colleagues that's not taking time off, have a chat about why. Because if they're not unplugging, they're not going to be performing their best. I do that to the leaders that I work with, and they love me for it, I'm sure. But we make sure that you're getting that break from the action. One of the things in government and in many businesses that you can't control is the volume of work headed your way. And we clearly communicate that to all of our folks. My OSHA, for example, workplace safety and health, complaints come in. There's nothing we can do about that. And we have to manage that work. But as leaders, we also have to be mindful, and something I try to do, and I think we all should try to do, is think about how much work those individuals are carrying and trying to find ways to structure work in a way that recognizes they need that time off. Humans can only do so much as humans, and that we need to support each other well enough to make sure that they can get through the tasks that they need. And then, being more flexible about days off. A lot of PTO programs or sick leave programs have these built-in kind of historical requirements of certain notice and all these types of things that you have to do. The state of Michigan as an employer is loosening up some of those tools to make sure that if you need a mental health day, you can take a mental health day. It's okay. And make sure that people have access to those tools. And then we're reinforcing, I know Sagar, you and I have talked about this before, reinforcing the value of our employee assistance programs. So for those people, as Darcy said, we know the majority of people that could use help aren't going to go get it, but we want to make sure if they choose to, that the tools we have are good and that we're evaluating those tools for the right reasons and not sort of business acumen of the EAP provider, but what they're providing to the employees. So bureaucracy does make it more challenging, but there are a lot of what I would call pretty simple steps of just recognizing the human in that human resource component and wearing that hat. One last point. One thing we try to spread across the department, you'll hear me say a few times today, is this is happening to all of us, not just like employees. So when we talk with employers, it's always managers thinking about the employees. And I remind them all, it's happening to you too. And you need to think about how you're doing this for all levels of the organization to make sure that we're going to be as effective as we can.
Sean, a great answer, comprehensive. A 1,000-page government report. Thank you very much. I did hear many of the positive things that Dr. Porath would have, wanted to hear. There's a pulse taking, like how are people doing? There's a flexibility about taking time off, and there are a variety of other measures that it sounds like have been implemented in your workplace that augur well for the future. So Darcy, just when you thought it was safe, I'm going to change the question. All right. You were probably well prepared for the question, but I'm only changing it a little bit. And this is very personalized for you, because in the various workplaces you've been involved with, you've had the opportunity to look at it from a meta perspective, a kind of a public health or a societal perspective. And, you've heard a lot of talk from the plenary and from the panelists about some individual, what are the principles of building community, for instance? How are they operationalizing it, in Holly or Sean's organization? What's your take, when you sit back and look at the country? You did quote the statistic, like an epidemiologist about, unfortunately, 50% of our youth are struggling. But what's your take on how we as organizations, are we beginning to make the shift to valuing wellness or mental health, or are we way behind?
I would say if you follow the media stories, which are incredible every week, no, I actually really think that we are making the shift. I think employers are really interested because they see the importance and they are hearing from their employees, whether it's through surveys, whether it's through what the consulting groups like Deloitte and McKinsey are putting out, or they know that they must do more. And so I think that's really exciting. And I think they see that there are different areas, and it's so dependent on the industry, but different areas to be covered. Some industry stigma runs really high. So some male-dominated, stoic culture, those types of businesses. So there's a real interest in focusing on raising awareness and educating. And there are some that are the tech industry, I think, although the layoffs have made this more complicated, but there's certainly a bit more openness and more interest in kind of what should we be doing culturally? How do we prevent burnout given workload? And by the way, I love what Holly and Sean said. It's leadership, it's culture, it's community is about how people feel in the place they work, whether it's through a screen or in four walls. It's about, do they want to go to work every day? It's why during COVID, we had this great resignation, whatever you want to call it. People kind of woke up and said, do I like where I work? For many, not all, but some. And so there's this idea of what is the environment like where people work? What's the culture like? Do we train managers? Are managers empathetic and compassionate and vulnerable at times? Do we have flexibility? This big discussion around remote, hybrid, in office is so complex. For all your HR folks in the audience, they know that better than I do. Very difficult. Many leaders aren't sure what to do with that one and are trying different things. And the studies are all over the map in terms of what's right. But this idea of improving access to care too is becoming a more recognized issue, because it is really hard to navigate mental health care in this country. And you can have an EAP that no one uses, and you can have an EAP that counts the number of clicks on their website as the number of encounters. But the question becomes, are people getting timely, affordable, effective connection to the care that they need, even those that raise their hand, which is not enough. So, I mean, there's a lot of moving parts. The only thing I'll say is the research is really solid on burnout, and it's so many things that were just said. It's workload, it's people feeling autonomous, it's community, it's fairness, it's feeling valued and like there's a purpose for their work. It's reward and recognition, just leaders saying, job well done, way to go, not from a platform on a stage, but just day-to-day recognition that the work people are doing is important and how it ties back into purpose and meaning and value. So those are the things that I think employers are really focusing on. I would say the burnout rates have been stubbornly high. And there's all kinds of reasons that researchers will say why. Part of it can be the way they count, and they ask the question without people knowing the scientific definition or the World Health Organization definition that they came out with in May of 2019, by the way, pre-pandemic. And the reason they did was because burnout had become an occupational hazard. So we are now seeing this shift to it being even more of a concern. And I think employers are starting to say, let's get real about burnout and what that means. And by the way, those 6 elements don't have to all be tackled. You can pick out 1 or 2. Workload will be an issue. At a nonprofit, our mission is huge. We are constantly checking in with each other. We do a lot of teamwork. We do a lot of community building. And by the way, we have rest up week every week where we close not every week, every year, where we close the whole organization. So that, and people feel a sense of belonging to a community that's valuable when you can do that. So, I mean, those are a lot of the areas I would say: raising awareness, training, looking at your culture really critically, and leadership is very important there. And then ensuring this access to services and supports when and where people need it is a biggie.
Thank you, Darcy. So even though there were some grim statistics that had preceded these comments, I actually detect a note of optimism and positivity, which is encouraging in spite of the magnitude of the problems that we're facing. Just before I ask Cinziana to grill the three of you and make sure you earn your money here, I wanted to remind the audience, this is a discussion, and we had some really good questions for our plenary speaker. And I know that we're all used to like listening, and then near the end, I'll think of a question. But if you think of a question, as any one of the panelists, makes a remark, just pop it in the Q&A, and we'll get to it. We may get to it later, but when it's fresh on your mind, commit it to writing. And we right now the field is open. We have no open questions, so be the first. If you're competitive, you can be the first. Cinziana.
Thank you, Sagar. I just want to say I love how passionate everyone on this panel is. And, I could see through everyone's answers that, we're really here to try to, make a move and move the needle on this topic. So I would like to change it up and kind of bring up the barriers topic to all of you. I know that you shared a little bit through your answers, but maybe specifically choose one barrier that you're seeing in your world, in your organization, to employee mental health, and maybe talk about, how can employers overcome it. Holly, I want to start with you, and especially, kind of coming from the small business perspective. That's something that, we work with small businesses at the chamber. I hear a lot of this discussion and conversation, we don't have the budget, we're short-staffed, we really don't have the time to invest in our employees as it relates to mental health. And then, small businesses see the turnover and they're wondering why that's happening, right? So Holly, do you have any thoughts on, a couple of barriers or one of the biggest barriers that you're seeing, and how can employers and businesses overcome that?
Yeah, I think, if I were to summarize it in one word, it's scarcity. Right. I think especially in small business and nonprofit, especially, we have a scarcity mentality. There doesn't feel like there's enough hours in the day to achieve our mission. There's not enough dollars. And there's always this notion that you're accountable to the public because the public funds you in the nonprofit world. Right. So if there was one thing I can change in the world, it's the way we talk about nonprofit overhead and talk about impact instead of overhead. I remember talking to a corporation, and they said, kind of like a tough question, like, what is your overhead? And I said, what's yours? Like, everyone in the room here is overhead. I would rather we talk about impact, because that's really the game we're in, is changing lives. And so I think if we can reset our mindset to say, look, what we do matters, and taking care of ourselves so that we can take care of others is vitally important. You're going to get out of that at the end of the day with impact in the community based on what you invest. And having more nonprofits think about that differently. About it can't always be mission focused. Sometimes you have to look inward and look at yourselves and take care of yourselves and your teams.
Thank you, Holly. I think especially in the small business world, it could be hard, but you're right. It's like, take care of yourself, take care of your teams, and then you're really going to see overall productivity and business success. So I love that. Darcy, I'll go over to you.
Yeah, so I would say in terms of barriers, I think what I'll speak outside of NAMI, just with the organizations that I've worked with, I would say psychological safety and people feeling like I won't lose the confidence of my coworkers. I won't to get, plum projects. I won't lose opportunities for advancement. People, it's easy for, well, I shouldn't say it's easy, but I think people hear from those that are well established, whether it's athletes or professionals at a higher level. And again, this can be really industry specific, but the barrier of it sort of goes to stigma. It's the feeling of judgment, of people won't have confidence in me. I won't be given the plum projects. I won't have those opportunities. That's a big barrier to people connecting with care. And there's still those myths and stereotypes that exist. And I think the other biggest barrier, anyone who's tried to navigate the mental health system knows you can have your insurance card and your benefits, and you can, think I'm just going to get a therapist. And, most, what you find is that most therapists have a full line of people they're working with. They are not accepting new patients. They have a 3 to 6 month wait. And for many, they have to pay out of pocket. And that's such an economic barrier. So there are a lot of barriers to people connecting with care. And it's really important, I think, for employers to be strategic around how to break down some of that and really be thinking about how to leverage their purchasing power to make a difference so that people can get access to care, because the barrier of navigating care is really challenging.
Thank you, Darcy. Very, very well said. Sean?
Yeah, Darcy actually touched on one point that I was going to make, but I'll touch on it anyway. This concept of stigma, I think in groups like this, talking with sort of C-suite or manager level employers, like we're kind of getting there. And I've heard employers say, we're at the precipice of stigma. And I always say, I think that's true in this room, but I don't think that's true on the shop floor, so to speak. I think that I'm an electrician by trade as well. I spent a lot of years in the field as an electrician, and in that industry, male-dominated industry to begin with. So you have that stoic, like you said, Darcy, kind of mentality, but there's inherent competition between us as well, because in construction in particular, jobs get big, they get small, you get layoffs, you get all this kind of stuff. So seeing my coworker fail, whether conscious or subconscious, may be a benefit to me. And I might not, really understand or care enough to stand up and say something like, hey, what's going on, Sean? Do you need some help? And I don't think people do it consciously, but I think that happens across all kinds of workplaces. And to Darcy's point, that includes potential promotions, getting the plum job, something like that, where somebody else's failure could actually be good for you. So you might not be in a spot where you're going to want to help them out in the way that you normally would as a human being. So I think there's a lot of stigma to deal with there. And I think the other thing, historically, a lot of employers, and then many still think this, believe that you could pay your way out of a stressful job. That this is a really hard job, I'll just pay them a little more to do it. And the reality, I think we're all learning, and employers are learning at a fast pace, is that's not true. You might be paying more, but you're going to get less, because that chronic stress of that situation is just going to put that person in a position where they can't move forward or they can't succeed. So I think we're turning a corner, but I think there's a lot of work to be done down at the sort of the ground floor to get employees recognizing how beneficial everybody's success is for them.
That's a very interesting point, Sean. And I think, from the stigma perspective, you touched on it a little bit earlier. Well, first of all, it sounds like we all should practice empathy a little bit more, but then also practice what you preach, right? So really kind of be the role model, for taking a mental health day with your team, your coworkers, encourage people to, talk about mental health in the workplace, have those conversations. And, one thing that I try to do with my team is, not encourage after working hours, email communications and, all of those types of, workload nuisances that lead to mental health challenges, where you have to check your email at 11 p.m., right? So kind of practicing what you preach and encouraging your team, your, coworkers to kind of be more open about mental health and, engage in some of those strategies. So thank you for that. Sagar, it looks like your ask has worked. We have quite a few questions from the audience, so I'll turn it back to you.
Well, just before we start hitting those questions, I will amplify on your remarks about what are examples of something we're doing. And so one initiative that we're doing is we're keeping Zoom meetings shorter. All right. And we all have this tendency to, oh, this is such an important meeting. I can't, didn't I have this whole hour reserved for this Zoom meeting? And so we often tend to run Zoom meetings to like 30 seconds to the hour or something like that. And actually at Michigan Medicine, even the dean has requested that we end meetings 5 minutes early. And I thought we could do better than the dean. And I thought of a key principle that sometimes we joke about in mental health, which is psychotherapists, they bill you for an hour, but the therapy hour is actually only 50 minutes, 50 minutes. So I thought, why don't we apply that to Zoom meetings? why don't we try and finish Zoom meetings in 50 minutes? And I'm actually starting to move that way incrementally. I've started by ending meetings at 5 minutes. I've been doing that for a while, but now I'm trying to move it to ending meetings 10 minutes to the hour. So I'll next year's conference, I'll bring you evaluation data on that initiative. I'm going to pick up on one of the themes that just came up about stigma. And in fact, the very first question from the audience picked up on that stigma. And Darcy, I know you've had the experience in your previous workplace job of, understanding and collaborating with a number of different companies and industries. Are you aware of stigma reduction interventions that you think have been particularly successful? And I'm thinking not so much, like at the society level, I'm thinking at a company level. Can you think of any examples of something that a company has done to reduce stigma around mental health?
Yeah, I think one of the impressive things, well, I know from the research, and I'm not a researcher, but I know from reading the research that personal connection to someone who has lived experience is really one effective way to help combat stigma. And NAMI has a program called In Our Own Voice, which involves people speaking about their experience living with a mental health condition. And I know, for example, that at NAMI, I know we're talking about my previous job, but I know NAMI is working with Comcast in New Hampshire on presenting this to their employees so they can get a sense of hearing directly from a person with lived experience and what that is like. And I also, in my previous job at the foundation, I worked with Best Buy, and Best Buy had an employee who did a short video talking about his experience living with a mental health condition. So I think employers, they ended up, and of course they cleared it with him, and he had actually put it on LinkedIn, and they asked if he would mind sharing it with the company. I mean, it was this really lovely experience of sharing. So I think when and there are all kinds of, I know, caveats to this to make sure that people are comfortable, but I think that personal connection. The other thing I would say is we did a project when I was at the foundation with the construction industry. Talk about an industry that is male dominated and stoic and really values toughness and really lives with some of those stereotypes around mental health and, not being soft, in quotes. And we did a national survey, a report, and then a series of presentations. On one presentation we did for a company, the CEO was on, and he said in the chat, when I go to therapy, I put a note out to the team and widely to let people know I'm heading off to therapy. I'll be back in an hour, probably 50 minutes. But that again is leadership, culture, like those things really matter when it comes to people feeling more comfortable. It's a battle. It's not over yet, and we have a lot more work to do, but that personal conversation around mental health and people's firsthand experience is super helpful. And you don't have to necessarily have someone within the company. You can bring in an organization like NAMI or the other mental health groups to have people present to talk about what it's like to live with a mental health condition. Because what we know in this country is that people right up to the C-suite level live with diagnoses, and we don't always hear from them, but we know it's there.
Darcy, your comments remind me of a movement that's also in healthcare. So in healthcare, we have valued big data, large studies, hundreds of people getting this treatment or that treatment, but we sometimes lose sight of the person. And in response, some schools, I know at Columbia University, they have a narrative medicine program where the focus is on hearing an individual struggle with whatever health condition it is, not necessarily a mental health condition. But, while we value big data, 5,000 patients were in this study of a new medication or psychotherapy or whatever it was for treating something or the other. But we also need to hear the individual's experience. And I think, you were giving examples of how people with lived experience of mental health problems humanize the illness, and that is a very effective anti-stigma intervention. I'm going to take us in a slightly different direction for you, Holly. You've been very positive, so I'm deliberately picking this question for you. When it's good to be positive, it's important to be positive, but life is hard. And so what is that balance? Can we have such a thing as, and this is from the question, toxic positivity, and maybe like, it's going to be great, like overemphasizing rah, rah, rah and kumbaya and all that kind of stuff. How do we balance that? Holly?
A great question. The way I look at it is not so much that we want to be positive all the time, but how do we struggle well? Because struggle is part of the human condition. It's part of the day to day. Every day we're going to struggle, but how do we struggle well and keep moving forward? I think we try to be very honest. We have really rough days, and well-being to me isn't that everything is always great. It just means that we are equipping ourselves with better mechanisms to keep moving forward. As human beings, we are wired for negativity. It's our set point. So how do we be aware of that? And how do we continue to keep struggling up against that, right? And also holding each other accountable to that. I think that having both transparency, I love some of the comments earlier about leadership and being very vulnerable, right? So you need to set the stage for others. And I think sometimes it's okay. I mean, my team knows I put myself in timeout, and I will tell everybody I'm in timeout because I'm not fit to be around. And then coming back and saying why, right? It's okay to struggle. But it's not okay to scream at people, slam doors, and be aggressive, right? So trying to create a culture, and it's a work in progress always, right? We are all works in progress, that it's very real. Like, it's not that we aren't, and being empathetic. And I think that has created spaces for people to also be vulnerable and be very real and not surface level with some of the struggles, both personal and professional.
Right. No, I appreciate your nuancing of that, and that it's not a kind of glib, happiness or superficial positivity that we're seeking, but not to lose sight of the need to maintain a positive focus while appreciating the true nature of the challenges that we face. So, Sean, a number of the questions also focus on issues of related to, like, how do you know if something's working, like evaluation. There are a number of programs, there are even some corporations which deliver on a national scale various kinds of mental health training for managers and things like that. And I know, Sean, you've been involved in major reports on what works and what doesn't work in kind of workplace mental health and things like that. So, thinking both in your kind of official role or through a government position, as well as, your role as an individual expert, how do we know, and how should we be evaluating any of these things, whether they're stigma fighting or whether they're actual interventions to improve well-being?
Yeah, absolutely. And probably thanks, Sagar, for the most difficult question in the history of humans on making, how do we know if we're making progress on mental health? So first and foremost, you have to ask, right? You need to set your baseline. So you need to ask. You have to find ways to engage employees. I think it's important for everybody to know, like, we can't, like us as leaders, we can't just build this. We need everybody to build it with us. So we have to engage employees. And part of the process of that is asking them what's happening to them or how they feel right now. Now, a precursor to that is you have to build trust with the employees and the workers in the organization that you're going to respond to what they say, or some type of activity is going to happen, that it is anonymous and all those kinds of things. One thing we do share with employers that's very difficult is, because the vast majority of employees are not going to tell the employer that they're having a problem, a lot of this work you're going to do, you're going to have to find in your data. So we know employers see their healthcare costs, they see absenteeism. So absenteeism is one that you would measure. You're going to start implementing tools, and you're going to see if absenteeism goes down. I think in the data, we know that the average person without any kind of depressive symptoms will have about 8 sick days a year. For someone suffering from depression, the average is around 27. So if you're making some forward progress, you should see that number reduce. Productivity measurements, presenteeism, people that have depression come to work, but their brain's in a spot where it's not going to move forward. It's not that they don't want to, it's just that they can't move forward. So watching those productivity changes that can occur in your workplace. And understanding that, like I said, you're not going to see all the data. I did want to make one quick point, and I apologize, Sagar, on the stigma piece, is that because we're doing workforce or workplace focus, we focus a lot on the impacts of chronic stress and sort of our brain's pre-wired response to stress, and how once that is triggered, it's pretty much the same for all of us, right? I don't know if I don't see it. Yeah, well, he's nodding. Everybody, Sagar nodded, so I'm telling the truth because he's the expert. But kind of letting the average working person know that even though what might cause that response might be different between all of us, once it's triggered, we pretty much have the same kind of process that we're all going to go through. Gets the average working person out there, they all kind of like do the head slap and say, oh my God, there's not something wrong with me. I'm just going through whatever this is, and finding ways to be more resilient about that. But measuring that result is really, really challenging, but it's a continual process. Like I think we would all agree, this is a journey, not a destination. We're not gonna, there is no end game here. We just have to keep moving forward.
You know, Sean, I liked your answer in one particular way, and that is that you blended qualitative answers and quantitative measures. And so by that, I mean, you talked about like checking in with people and seeing how they're doing. And that's kind of like the qualitative aspect.
Yeah.
But there's also the quantitative in the sense like number of sick days and things like that. So there are a variety of ways, and it's important not to use only one metric like number of sick days or something like that to know if you're making progress. Well, you know, Cinziana, Sean did say I was being hard on him, so maybe you can apply a gentler touch to your questions.
I'll try, Sagar, thanks. So there's an interesting question here, and I think we all, or you all kind of touched on it in various ways, talking about trust. But we did talk about how some organizations have, you know, went through major layoffs. There might be some, you know, mistrust within the organization and its leadership. So how would you rebuild trust when it's broken within the organization? To get it to a point where, you know, employees feel safe talking about mental health and, you know, disclosing to their supervisors or leadership that they might be having an issue, they need some time off. How do we get back to that point when trust has been broken? Darcy, do you want to start from kind of a higher level perspective?
Sure. I think it matters how it got broken. So we'll leave that alone. Let's just say it got broken. I think one thing you can do, certainly, if you want to build trust around people feeling safe, getting help, mental health help when they need it, is to make mental health visible. Don't make it a May is Mental Health Month thing. Make it visible all year round. I think the higher the level, the more people hear from the highest levels and every level in between, the better. I think having managers and leaders check in with teams in new ways. We are not living right now at a time of, okay, let's go. What's the project deadline? Where are we at? Opening meetings with immediately jumping into work. We are at a different time now. And I've heard some really creative ways that leaders have started meetings to show that they are not afraid to be a bit vulnerable, that they recognize that we're human beings and our emotions have been challenged with all the uncertainty and all the things happening in the world. I mean, look at all the just climate disasters and all the political rhetoric. And I mean, leave the pandemic out. There's just so many other things happening. So checking in new ways and really being empathetic. Trust comes from a multitude of areas. It's not one area. And rebuilding it, you can lose trust like that. You have to take the time to rebuild it because it is foundational and fundamental to relationships. And so I would say make mental health visible, but also you have to walk the walk and talk the talk. So again, check in new ways, show vulnerability from the highest levels. When it comes to taking care of yourself and your mental health and well-being, talk about stress, survey your employees. Like, you have to start from the beginning and just watch it grow in terms of the results.
Thank you, Darcy. I love how you mentioned kind of, bring it back to humanity, right? Check in with each other. We're not just robots here to work. We all have personal things going on. We're really positioning a meeting in a way where you do have time to ask, how was your weekend? What did you do? Is there anything you're struggling with that I could help? So I love that. Thank you. Holly, I'll go to you next.
So I ditto what Darcy had said. But one of the things I think is that I would just say is trust is not just one thing. It's many things. And be looking at kind of, as was mentioned, it's a day-to-day, it's every day. It really, I feel like, starts with vulnerability. Because vulnerability is really the birthplace of where trust comes from. It's being able to feel safe, to be my authentic self with someone else, and trying to create, not just create environments for that, but also encouraging it. Maybe even creating a little bit of discomfort to be a little vulnerable, right? I have noticed in groups that the minute somebody gets really deeply vulnerable, it creates a space where everybody feels a lot more safe to do so. And so I think that's something we can all do as leaders, which requires a little bit of our unease, right? We've got to be a little different and take a little risk in being vulnerable ourselves. It can't just be somebody else always doing that. But just, again, it's not just one thing, it's many things. And listening. I mean, I know that sounds really rudimentary, but truly listening to understand, not just listening to respond.
Thank you. That was a really well answered question. Sean, I'll go to you next. And since Sagar gave you the hard question, I'll follow up.
Yeah.
But maybe you could include a point on, frontline healthcare workers and the whole conversation, about they feel like they can't disclose this information because of their professions and the industry that they're in, disclosing that you may be struggling with anxiety and depression, may lead to someone being suspended from their job or, being forced to take some, additional time off or things like that, where they don't feel comfortable disclosing those, issues that they're having. So if you can add that to your, rebuilding trust answer, that'd be great.
Yeah, so I would ditto, but adding to that, I think Darcy had said be tangible in the actions that you're taking. And I would encourage employers to just be honest about all aspects of the business, right? I think for many of us in the workplace, we feel like a disposable or expendable part of the continuity. And that's not really true, but I don't think people hear that. And now, certainly, no employer can say, hey, you're going to work here for the rest of your working career. Everything will be fine. We'll make sure you get raises all the time. But I think employers have a tendency to just kind of shield information too much about the condition of the company, the value that the employees add to the company. Some simple tools you can do that we recommend everybody. If you have a workplace safety committee, add mental health to the workplace safety committee. I mean, those are pretty easy things to do because certainly from a workplace safety and health perspective, all of this stuff is connected to that. Somebody being engaged, effective at work, not injuring themselves or their coworkers. So it's all tied together. So definitely visibility on what you want to do on the mental health front, but also just visibility in general and making sure that people understand how the company is operating. We have some real challenges in certain industries. So when you say healthcare workers, one of the things we focus on, and we've kind of come down to what we call 3 pillars of the work that we're doing. One is things that are happening in the workplace themselves. And when we think about healthcare workers in particular, and many other industries, frankly, but that one in particular, the shortages of skilled nursing professionals and other professionals within the hospital are putting nurses in particular in a position where they are working 7 days a week, 10, 12, 14, 16 hours a day with no potential breaks. So even if they are having some kind of mental health crisis, there's nowhere for them to go. There's nobody to backfill that spot, to cut down on the hours. So we're trying to find ways to help employers recognize, like, we got to figure out these workflows because this is not conducive to people maintaining their health and safety in the workplace or their longevity in the industry. But it also does impact on how they're perceived. I think being in line for that promotion or a change to a different part of the community, that the practice community, because it's big, right, than areas they could be, or something like that, is going to create a perception that they're not capable, when the reality is it might be their life, but it might be the work that's making them not capable at the moment, and they need a break from the action. I don't know the answer to that question. I think, frankly, when we talk with employers, and many are facing shortages of skilled workers, the pipeline, there's not enough people in the pipeline. There's not enough people that exist to fill the pipeline. So we're kind of in the spot where we have to rethink about how we're operating more holistically to create the foundation for success, so to speak. So I hope I hit that correct, but that's my thought, I guess.
You did, thank you. And I think we could hold another session in the future, on this topic, because there's a lot there. Sagar, back to you.
Yeah, so we're in our final 4 minutes, and when we finish these 4 minutes, we are actually taking a 10-minute break. And so in sort of wrapping up this session, I want everyone just to share one fun thing you do during your normal workday to help you relieve your stress. Or it might be more than one, but one is all you need to do. And I'll just start off. My own example is that I definitely set aside time for lunch, and there's a 24-hour jazz station out of Toronto called Jazz FM, and I turn that station on online, and I have my lunch, and I look forward to my lunch. I look forward to listening to that music. So that's one little thing I do for myself in my workday. Darcy.
So I am so bad at this, and I really want to try out some of the things you've suggested, but I'm hybrid. So when I'm home, I try to get outside and get some fresh air, even if it's a short walk. When I'm at the office, I eat my lunch at my desk. I'm really bad at it. I need to get better. I need to get some music going, I think. So I'm going to work on that. But I try to visit with colleagues. I try to get out of my office and walk around so I can see people, because the people-to-people connection is important. So I try to do that, but I need to work on this one.
Well, Darcy, I heard a commitment to change, so I'm going to follow up in 3 months with a call and see if you've changed. Holly. You're still mute.
Technical difficulty. I wish I could say I was better at it. I very intentionally listen to Calm. I have the Calm app on my phone, and I will sit in our massage chair here at the office, and for one whole cycle, I will just listen to something positive, right? Or and that it really does kind of reframe. And I think also other people, that gives them permission to take a minute, right, and pause. But also, I have been very intentional to try to get up and just check in every day, even if it's 4 or 5 minutes, right? Just kind of walk around and see how people are doing.
Thank you, Holly. Sean.
Remote work's actually made this harder, right? Because we're not as connected to people. So when I'm at home, like I am today, I have a few acres. We have a nice little pond, and I'll walk out to the pond. We call it the Shondarosa, everybody, just so you know, because we think that's funny. When I'm in the office now, because we're hybrid remote, there's typically not a lot of people around. So it's actually more difficult now at work, because one of the things I saw pop up in the chat is we've all have very serious jobs. And my goal in life is we're going to laugh a lot, even though we know we have the serious work to do. So we'll just pop in. When I pop in with coworkers, I don't talk about work. We just kind of get into other funny stuff or funny stories or whatever else to kind of just bring the volume down a little bit for us all. But it's more challenging now. The office is often empty. It's pretty lonely. It's not as much, fun to kind of be there. So then I try to take a walk, Sagar, and take a break from the action, because I am like Darcy. I'll just eat right at my desk, just kind of keep on trucking, but I do try to go like, time for a break.
We're going to start a panelist support group here to engage in change. Cynthiana, your tips?
So yeah, I think fresh air is great, but I'm going to go a different route here and just say that I try to practice gratitude when I can. And, even when I know I have a full day, a stressful day in the morning. I wake up, I, jot down a few things that I'm thankful, grateful for, and I just feel like it puts me in a positive mindset and, really kind of just makes the day go better. So that's my tip for everyone. It doesn't have to be an elaborate thing, but just jot down a few things you're, thankful and grateful for, either in the morning or before you go to bed, and your day is really going to be a lot more positive.
Well, I'm very grateful for your remarks, Cynthiana. And
Thank
with
you.
that, sorry. With that, we are now going to take a 10-minute break. We will start at 3 o'clock. One or two housekeeping details. Number one, if you want to go to session number 1, it's the same link, the same Zoom link. And if you want to go to session number 2,